Hi, it's Alistair at Lazarus Training, and we were asked recently for some advice about what to do if someone was to have a seizure in the workplace. So we're putting together a very basic video just to cover some things. So what are we likely to see if someone has a seizure? Well, we've all got that idea in our minds that the person may be on the floor, they may be moving around, there may be foam at their mouth, their muscles may be clenching, their eyes may be moving, they may be grinding their teeth, and they may actually lose control of the bowel and bladder. So the first thing we need to do if we're faced with someone having a seizure is probably take a bit of a breath ourselves. It's going to be okay. They just need a little bit of help from you to look after them. So things we need to watch out for. Anything that could be causing the casualty any danger. Now that could be obvious things like if they're at the top of the stairs, but it can also be discreet things such as objects nearby them which they might bang up against. And unfortunately, if it's in a public place, we might need to consider that other people can potentially be a danger because they may try and help, but help too much. For example, trying to put something into the person's mouth to stop them biting their tongue. We don't expect that to happen. We don't need that kind of activity. So, what kind of things might we see whilst the fit's going on? We've just quickly looked at those. What do we need you to do? Keep calm and keep everybody else calm. But there are a few practical measures that we'd ask you to consider. Have a look down at the casualty and look at is there anything that's likely to cause them any danger. So in our setup here, I'm a bit worried about the radiator thing that she's close to, so I'm going to move that out of the way. Because Claire isn't fitting too much, I'm a bit worried that she may be banging her head on the floor, but there's no other complications, so I'm going to try and get something soft underneath her head just to protect it slightly. Now we must be careful when we do this, that we don't do anything that may compromise the person's airway. So it's just a bit of basic cushioning so she's not hitting her head on the floor. Now most seizures only last a couple of minutes, and so we need to really be watching and planning ahead of what we're going to do when the seizure finishes. Now, if the person has no known history of having seizures, we'd recommend that you call for an ambulance straight away. If the person's seizure goes on for more than a couple of minutes, it's probably wise to call for an ambulance just to be on the safe side. And even if the person has a known history of having seizures, if they have a seizure, don't wake up and then have a second seizure, we'd again recommend that you call for an ambulance, as the body will get so tired out by this serious event, they're probably going to need some help. So whilst they're having a seizure, we don't really expect you to do too much, apart from, as already mentioned, protect them from harm. If they're not moving very much, you might be tempted to move them into the recovery position, something I'm going to return to shortly. But your main job is to keep calm, keep everyone else around you calm, and keep talking away to the casualty to give them reassurance. Even though they may not be responding, it's quite likely they can still hear you. Now when the seizure finishes, the person may be in a number of different conditions. Some people will be awake, alert, aware of what's happened, probably embarrassed and want to move away from the scene. Treat them in the way that you would want to be treated. Calm them down, tell them everything's going to be fine, spend some time with them and consider what is appropriate for them now. Should they have some rest time in the first aid room? Should they be sat with others? Do they want to go home, escorted perhaps? But that's one group of people. We may see a second group of people who will respond if you shout at them or poke at them, but they're not responding to you fully. We still need to keep a very careful eye on them and monitor them, again, in the way that you would want to be looked after. The group that particularly worries us though is anybody that doesn't fully respond after they've had their seizure, and perhaps they're still laying in this position. Now if someone's not fully responsive, this is actually quite a dangerous position for them to be in. Laying on their back, we're worried they may swallow their tongue, they can't clear saliva out their mouth, and they're in a risky position. If you've been trained in first aid and know how to choose the recovery position, this would be the time. If you haven't, don't worry, I'm going to show you how to do that in a moment. Because I'm not happy with the way that Claire is responding after her seizure, I'm going to put her into the recovery position. It has only a couple of simple steps that we'd like you to do, and this is the ideal way of moving somebody safely and carefully into a comfortable position. The arm nearest to me, what I'm going to do is I'm going to bring that up, and if I can, just slightly introduce it behind her head without moving her head too much. The hand furthest away, I'm going to bring this across and use this to cushion her face, trying to make sure that her watch isn't in the way. Now because I'm taller than Claire, I can leave the leg to the end, but basically I move the leg up into this type of position. If the person's bigger than you, you might want to do that at the beginning, And if they're really bigger than you, that might be the only bit that you want to do. But you make sure you've got hold of the person's knee, push down on their knee, and over they come. This is basically the recovery position, but there's a couple of final things I'd like you to do. Bring the knee over and bring it up so it's at that sort of angle. That will support them and keep the abdomen off the floor. Make sure that their mouth is open so any snot, saliva, dribble and stuff can come out, and then you probably want to quickly check them for breathing. Now if you're ever in any doubt about somebody breathing, the simplest way to check it is to put one hand on their abdomen, one hand on their back, and then you squeeze together. And the person's abdomen should move like a set of bellows. And we expect to see that twice in every 10 seconds. So let me show you that working properly with Claire breathing properly. So one hand on the back, one hand on the front, a little bit of a squeeze, and you can see my hand being moved as her diaphragm moves up and down. The good news is Claire's breathing. She's in a safe, stable, secure position, and I'm going to sit here with her until help arrives, which hopefully one of my colleagues has called for. Now obviously a short video like this, we can't cover all the things that can go on with someone having a seizure, the causes, some of the unusual things that could occur, but hopefully this video will give you some confidence to deal with somebody who may have a seizure in front of you. If you want to know more, obviously send us questions. If this is on social media, put it into the comment section, but ideally get yourself onto a first aid course. Speak to your health and safety reps in your workplace and see if they can arrange one for you.